Hello and welcome to new um, tutorial. In this tutorial, we'll look at alcohol consumption worldwide. We're looking at some alcohol data. Um, in terms of data sources, it's going to be mixed between global bodies and the charities, and also a few local um, statistics. Okay, so let's start. So, first of all, starting with the UK. So we have um, a drink aware. So, independent charity aims to reduce alcohol-related harm by helping people make better choices about their drinking. So, so here they're making comparison between England, Wales, Scotland, and Northern Ireland. So, in terms of England, in 2019, 48% of adults aged 16 and over reported drinking alcohol at least once a week. Wales, similar percentage, 48%. Scotland, 50% of adults aged 16 um, and over reported drinking alcohol at least once a week. Northern Ireland, 58% is the highest. Looking across gender, England, we have 55% males and 41% females. In Wales, we have 55 males and 40% females. Scotland, we have 56% males and 43 females. Northern Ireland, we have 65% males and 52 females. Now, we have also comparison across how often do people drink alcohol in the UK. So from 2015 to 2021, so we see the tendency in terms of Northern Ireland is the highest, um, where we have um, England and Wales lowest. I think we're missing data in terms of England. Okay. How many people do not drink alcohol? England, 20% adults. Wales, 20%. Scotland, 17%. And Northern Ireland, 90%. How many people don't drink alcohol in the UK? Percentage of non-drinkers in the UK. So, okay. How much alcohol do people drink each week in the UK? So, up to 14 units, more than 14 units. So this interactive charts. Okay. So you have also a drinking risk weekly units. So most of them drinking, talking about low risk, um, a gray increasing risk and red high risk. We see similar rates. Now, how much do people spend on alcohol? England, so average spend on alcohol per person per week, £7.28. which is 13 higher than it was in 1516. We have Wales. We have less £6 and 24 pence. Scotland £6 78 pence, and Northern Ireland £6 and 2 pence. UK £7 and 43 pence. You need to understand that there are differences in terms of standard of living across England, Wales, Scotland, and Northern Ireland. So you need to think of that. So when you do any research, you need to think of control variables. So when you're taking these factors into consideration. Okay. Okay, we have also Alcohol Change UK. It's another charity looking at alcohol in the UK, saying in England there were an estimated of 600,000, 2,391 dependent drinkers. Only 18% are receiving treatment. UK data shows that 2020 there were around 8,974 alcohol specific deaths, so around 14 per 100,000 people, and that's 18.6 increase in deaths from 2019. Okay, alcohol and health. Here they saying, remember this: alcohol is a causal factor in more than 60 medical conditions. We're saying 60 medical conditions, including mouth, throat, stomach, liver, and breast cancers, high blood pressure, cirrhosis of the liver, and depression. In England, 2019-20, there were 6,425 hospital admissions related to alcohol consumption, a rate of 12% higher than 2016-2017. Wales, 54,900 alcohol-related hospital admissions. We have Wales, the rate of alcohol-specific hospital admissions 3.3 times higher in the most deprived areas. Scotland, there were around 35,781 alcohol-related hospital admissions. Death rate in terms of Scotland, we have 25.1 per 100,000. England, we have a lower percentage. You need to bear in mind the population. So population in England is higher than Scotland and Wales and Northern Ireland. So England, 13 per 100,000. Wales, 13.9 per 100,000 population. Northern Ireland, the alcohol specific death rate was 19.6 per 100,000 population. So population in England is the highest. So we see that these figures in Scotland, Wales, and Northern Ireland are higher than England. Okay. There are other statistics in relation to age group and gender as well, but let's just move on. Um, we have also, in terms of data, government publications, in terms of alcohol chapter updated 2021. So in relation to alcohol misuse in England among people aged 15 to 49 years, alcohol is the leading cause of ill health, disability, and death. So you're talking about three things: ill death, disability, and death. Alcohol misuse across the UK is a significant public health problem with major health, social, and economic consequences, estimated at between 21 and 52 billion a year. So this number is a huge in terms of the consequences of alcohol consumption, or let's say alcohol misuse. Yeah. Every year there are over 1 million admissions to hospital for alcohol-related conditions. Alcohol consumption is a public health issue across Europe, which has the highest per capita consumption of alcohol of all regions globally, and the highest level of alcohol-related harms. Harmful use of alcohol contributes not only to the burden of non-communicable diseases, but also to the burden of communicable diseases as well as violence and injuries. Began to go to look at um, these are important facts and important information. The highest earners, those earning 40,000 and above annually, are more likely to be frequent drinkers and binge on their heaviest drinking day when compared with lowest earners. So these information are important because if you are doing study or doing research on alcohol consumption or alcohol misuse, it's very important to know about the control variables and also to know about differences, the demographics. in terms of alcohol consumption. So you need to know about age groups, um, gender, income, socioeconomic status, and also regions. Um, so also in terms of drinking habits. So you're saying here similar patterns of drinking were observed in England, Scotland, Wales. Of the English regions, binge drinking was more common in the north. Okay. Among men who binged, normal strength beer was the most popular choice of alcohol. So for um, male, for females, wine was the most popular choice. We have also another source in terms of um, Office of National Statistics. We have more recent data, alcohol specific deaths in the UK registered in 2020. So we have 2020, there were 8,974 deaths. So 14 per 100,000 population. So that's an increase of 18.6% compared with 2019.